Welcome. My name is Peter Strong, and I'm a professional psychotherapist specializing in mindfulness therapy, which I offer over Skype. So Skype therapy is basically nothing more than delivering psychotherapy over Skype. The reason why we use Skype is because it allows us to see each other, and that is really the most important thing for psychotherapy online. You have to be able to see each other. So basically Skype therapy describes any kind of mode of psychotherapy that is delivered via Skype. But the type of psychotherapy that I specialize in is mindfulness therapy, which works extremely well over Skype. This is because the focus of Skype-based mindfulness therapy is teaching you practical methods of working with your anxiety or depression or addiction or emotional trauma using the well-tested and very effective methods of mindfulness therapy. The first thing that I will teach you in the first Skype therapy session is about how to change the relationship that you have with your emotions and with your thoughts and beliefs. This is really quite important. The major cause of emotional suffering, whether that's anxiety or depression or addiction, is the process called reactive identification, whereby you become blindly attached and identified with the mind, with thoughts, beliefs, emotional reactions, memories, perceptions, and so on. Now, all of those mental phenomena are technically described as mental objects, and they arise in the mind, and they exist for a while, and then they pass away. That's the normal scheme of things. The problem is that we tend to become identified with these mental objects, and that stops them from resolving in the normal cycle. So that keeps them in the mind and stops them resolving. So the first teaching in mindfulness therapy is about learning how to break this blind habit of identification with thoughts, emotions, memories, and perceptions. And the way we do this is by meditating on these mental objects. We learn to pull ourselves out of the identification habit, whereby we become consumed by the emotional reactions or thoughts, and we learn to see them as an observer. That observer is, by definition, independent from the mental objects that it observes. So becoming the observer is rather like becoming the audience that watches a movie instead of becoming part of the movie. So developing that relationship as the observer is one of the primary teachings in mindfulness therapy. That's really important, because if you identify with thoughts and emotional reactions, then what that does is that it feeds those emotional formations, and it tends to cause them to proliferate and to not resolve. So learning to see them clearly, learning to sit with your emotions without becoming reactive, that is the most productive thing that you can do to promote healing. When you can create that space around an emotion or thought or memory, if it's a traumatic memory. Without reacting, you no longer feed that emotional formation, and then it continues its natural life cycle, which ends up in its resolution and healing. So by sitting in a non-reactive manner, in a mindful manner, with our thoughts and emotions, we allow them to heal. That's a very important principle. So the second principle is that we can respond when we're not reacting to those emotions and help them heal. We can facilitate the healing process. And this is called the response of compassion, which is an integral part of mindfulness practice. Mindfulness is much more than just becoming aware of experiences in the mind. It is about responding to those experiences in the mind with compassion and with friendliness and with those factors that promote healing. Of course, when we encounter unpleasant emotions like fear and anger and shame or guilt or depression, we tend to fall into this trap of reacting with aversion. We push those unpleasant feelings away. This reactivity does nothing else than feed the emotions and prevents them from healing. So that's one of the primary reasons why we focus on developing a compassionate and friendly relationship with our emotions, because quite simply they will not heal until you do that. So after forming a non-reactive and friendly relationship with your anxiety or depression, or with your guilt or shame or low self-esteem or anger or whatever it might be, when you can sit with that without reacting, then you begin to explore what helps it change. And the primary mechanism through which emotions change is through changing their imagery. So all emotions are based around imagery, and it's when we can see this imagery and then help that imagery change that we can help the emotion heal. So working with imagery is another vital component of mindfulness therapy. I will teach you all of these methods. I will teach you how to work with your emotions using mindfulness, and I will teach you how to meditate on your emotions using mindfulness. Mindfulness meditation is a very powerful method for developing these inner healing pathways based on conscious awareness, friendliness, compassion, and non-reactivity. Mindfulness meditation is not about trying to escape thoughts. It's not about trying to create an altered state of consciousness that feels good. That's not the purpose of mindfulness meditation. The purpose of mindfulness meditation is to meditate on the mind. It's literally to develop a greater conscious presence with those mental objects, whatever they are, including perceptions. So being more mindful of eating your dinner is becoming more mindful of the mental perceptions that arise as you are eating your dinner. So when we apply mindfulness, we are learning how to break free from the habits that sustain suffering and prevent its healing. And that's why it's so powerful. So if you like the idea of Skype therapy, and you like the idea of mindfulness therapy, then please reach out to me by email. Let's schedule a Skype therapy session. I see people worldwide. Most of my clients live in America, but I also see clients in Western Europe and as far away as South Korea and Australia. So please contact me if you'd like to learn more about how to effectively overcome anxiety and depression using Skype therapy and mindfulness therapy. Thank you.